Welcome to the New Day Podcast. I'm Pam Ford, Executive Director of New Day Employment Network. You can learn more about our work at newdayemploymentnetwork.org. Each month, we spotlight a Justice Alliance organization making meaningful change in our communities, supporting individuals impacted by the justice system and building pathways to opportunity. The Justice Alliance was created because I recognize a challenge. Too many organizations were working in silos, duplicating efforts, and missing opportunities to combine our strengths. We needed all hands on deck, and that's when the idea for the Justice Alliance was born. To bring this vision to life, I asked Lachey Hudson to lead the Alliance, to build connections, to break down silos, and ensure that every voice has a seat at the table. Today, we're highlighting Get Covered Illinois, a dedicated partner making a real impact in our community. Let's get into their story.
Good afternoon, everybody. My name is Lachey Hudson, and I am the Justice Alliance Coordinator. Welcome to the Justice Alliance Podcast. The Justice Alliance is a division of New Day Employment Network. The Justice Alliance is comprised of 12 organizations that assist pre- and post-release individuals from prison. We are here to assist the reentry community with their impact services and with their emergent needs, such as housing, trauma-informed behavioral care, recovery, peer support services, faith-based services, and also with Medicaid and Medicare. Today, we're going to highlight and spotlight one of our great members, which is the Will County Department of Health. We're going to spotlight those individuals who do the heavy groundwork, the heavy boot work in the community. So today I want to introduce our guests, Miss Linda Larson and Miss Rosa Gomez. Please welcome our guests.
Hi.
Hi, welcome. Welcome to our set. Welcome to the Justice Alliance. So I want our audience to get to know you a little bit better. So tell me who you are and the heart behind the work you do. Linda, you want to start first?
Yes. Hi, Lachey.
Hi.
My name is Linda Larson, and I work for the Will County Community Health Center, a division of Will County Health Department, for the past 26 years. And I help people I'm an outreach specialist and a healthcare navigator, helping people apply for benefits so they can get their healthcare and food assistance, and also Medicare savings, family planning, and navigate so they can get the proper care that they need.
And tell me about the heart, about the work that you do.
I have a passion for helping people. I always have. I have 7 children, so I'm usually helping a lot of people. So I love to help people.
And Rosa, tell us who you are and what your heart behind the community work that you do.
So as you said, I am Rosa. I've been with the Will County Health Department and the Will County Community Health Center since 2003. I am also a navigator. We assist people, like Linda mentioned, with the needs for medical needs, food stamp needs, applying for the savings program for those that qualified, and that it means paying for their Medicare monthly payment. We assist everybody in the community. We assist with Will County, Grundy County, and everybody is welcome at the Will County Community Health Center.
And the Will County Community Health Center is bilingual.
Yes, for most of the departments, we also have translators there as well to assist the clients that come in to the Community Health Center.
And for the Justice Alliance, we are specifically assisting reentry. So how is it that the Will County Health Department can assist those who are incarcerated or, pre-released or post-incarceration?
So as navigators, we assist them. We go or are in communication with the probation officers, and those that are going to be released, we assist them with getting the medical coverage for them, or any other need as far as like SNAP benefits if they need it, or any other needs that may need in reference to medical needs, that they would need. Linda, my coworker, also goes to stepping stones to a system, and that's for the once they are released, to get them integrated into the program and into the community. And she can tell you a little bit of what they.
Linda, how
Yes.
can our post-release or formerly incarcerated individuals, how can they reach either of you?
Well, they can call our call line, which is 815-774-6090, or
At the Will County Community Health Center, it's 815-727-8670.
Are there any restrictions for our formerly incarcerated community in
None.
coming to visit you or coming to call you? Where can they visit you?
Yes, they can actually. They can come in and ask for us, like we are the navigators, or as we are known for Medicaid ladies. They come in. We also know that those that are incarcerated and they need services from the community health center, especially if they are like the OB, if they are pregnant, they do bring them in. The sheriff brings them in. So we do provide services for them as well.
So you have gender-specific assistance for our formerly incarcerated women who are pregnant or
They need medical. They do.
they need
come-
medical assistance.
They do come in. We see them.
Do you only help them, Linda, with medical assistance, or do you help them with other impact services as well?
we can help them apply for SNAP benefits if they're no longer incarcerated. Yeah, and we have family planning. And then also, after we apply them for benefits, we can give them resources. They can come to our clinic for mental health services.
Okay.
Like Rosa said, OB-GYN services. We also have dental, vision,
Okay. And is there
variety
any
of services.
income requirement or employment requirement?
No employment requirement. I know they do have a income scale base for those that do have income.
Okay.
And it's based on that scale. With those services, we do have the TB clinic there as well in the WIC program. And they are all combined within the Will County Health Department. So we're a division underneath the Will County Health Department.
Wonderful. And can you tell me, when people hear your name or your organization's name, what do you hope it represents?
Well, I hope that it represents us in good faith, that we are there to help them, that they can come to us, that if they need any kind of assistance, that we are able to provide for them. When they mention our names, I'm hoping that they can have a positive impact or experience with us as far as us helping them. Most of the time, we do hear very good things about the community health center or ourselves, that we are able to assist them or help them. Believe it or not, it has a big impact on them, especially when they come into us and they are in need. We have a lot of people that are coming from other not only from other states, but from nations right now.
Okay.
We have a big impact on that. We are helping them out. We have in the past several years assisting them with even helping them with getting them the resources for the housing that they needed, or maybe finding work or training they would need. We were helping them out to get that assistance needed for them. A big thing that we were helping them out was to go ahead and get them medical coverage for the children.
Wow.
Because it was a big necessity for them.
Sure.
To be able to enroll those children in school. And our population here in Will County, our population is basically Spanish speaking.
Okay.
In the community, and right now that is some of the population that we are targeting, the people that are in need of services.
Wow. And Linda, you are famous in Will County.
I know. I tend to know someone everywhere I go. But people seek us out.
But
not
who are
only-
you when they hear Linda Larson?
Right.
Tell me what you hope people will
I
think of when
think
they hear
they
your name.
feel they feel comfortable, someone they can trust, someone they know is kind, and someone who cares and is going to help them.
Wow. And then when they hear about your organization, what do you hope they will gain from when they hear Linda Larson of Will County Health Department?
They feel comfortable coming there because it kind of feels, like a familiar place,
Yeah.
familiar people, people who are willing to go above and beyond to help, people who really care.
Okay. And again, give me that address and that phone number so that people can reach you.
So the Will County Community Health Center is located at 1106 Neal Avenue in Joliet.
Okay.
The health department is right next door. That's 501 Ella Avenue in Joliet. And then we have branches in Bolingbrook. That's the northern branch office. That is at, we have a clinic there. It's 391 Quadrangle Drive.
Okay.
And then we also have WIC services and mental health services there. And that's a different building. The WIC is 323 Quadrangle Drive. It's all in the same shopping like square.
Okay.
And then Rosa goes to Moni.
Moni. I go there once a month to Moni, or if more if needed. If
Okay.
there's people to see there, I will also go. I go there at the last Wednesday of each month. It's in Moni, and I apologize. The address, I don't know it off the top of my head.
But it's the Will County Community Health Department in Moni.
In Moni, and they have
Okay.
environmental health services there. They have
Okay.
the WIC program, and then the clinic for us there.
And also, those who are formerly incarcerated will also be welcome there in Moni and in Bolingbrook as well.
Anywhere that they would need services and we can accommodate for them, we will see them.
Okay, wonderful. And then getting back to the hot topic of after January 1st is you all have a new program and a new initiative called Get Covered Illinois. Can you speak to me about Get Covered Illinois and who can be covered?
Okay, so Get Covered Illinois was known as Obamacare
Okay.
back when it started.
Okay.
And it was a requirement up to 2019 for people to have insurance. It was a requirement. It's no longer a requirement. So the Get Covered Illinois is for people to buy insurance who do not qualify for Medicaid,
Okay.
based on their income or their citizenship. Those are the main two reasons why they would not qualify.
What are the income guidelines?
So it depends. There is different income guidelines for adults and children and over 65. It depends of the poverty level, which is 100. If you're over 134% of the poverty level. So for let's say for a family of two under the age of 64, if your income is over 1,900, about 36 a month, then you would qualify for the Get Covered Illinois. With that being said, the Get Covered Illinois, the state of Illinois will go ahead and give you a tax credit, which helps you pay for your insurance.
So-
And it's based on the number of household and your income.
So are you saying that two people with a combined income of, say that number again?
Over 1,936 a month, you would qualify to get insurance through Get Covered Illinois.
Okay, but if you're over the $1,900, then you
So
do not qualify.
No, you have to be over the 1,900.
Oh, over the 19.
To qualify and get a tax credit.
Okay,
Under that, you would qualify for Medicaid.
okay, wonderful. So how old do you have to be in order to receive Get Covered?
So Get Covered Illinois, there's no age limit. It's anybody that would not qualify for Medicaid can apply for Get Covered Illinois, or if you don't meet the immigration status, which would be for adults, if they are not a permanent resident for 5 years or more, then you would qualify for Get Covered Illinois because you would not be eligible for Medicaid.
Okay, so what is the difference between Get Covered Illinois and the Affordable Care Act, which is Obamacare? What is the difference?
The difference now is that Obamacare was federally funded,
Okay.
federally based,
Okay.
and now it's state based.
What is the maximum amount of income you can make in order to qualify?
It would depend on the number of people in household.
Okay.
But right now, we are seeing that because people have a high income and the rules have changed, they are no longer eligible for that tax credit. So we are seeing a decrease, unfortunately, in people actually purchasing insurance through Get Covered Illinois.
Do they have any other option besides Get Covered Illinois?
We always suggest for them to look into insurance with their employment if they are able to and if it's offered to them. That's
Okay.
the very first thing that we look at to see if they are eligible to get insurance through their employment.
So what if a person is gainfully employed, but their employment or their job does not offer insurance? health insurance?
Then this is where Get Cover Illinois comes in, and it's based on their income and based on the number of household members that they are, if qualified for a credit.
Okay. And how will they, Linda, be able to enroll in this?
Okay, so again, they can call us and make an appointment or come in and see us. Now, the open enrollment began November 1st of 2025.
Okay.
And it goes through January 15th. Now, that's for the open enrollment for coverage to begin, for this year, for 2026. However, once the open enrollment ends, they can still apply if they have a special circumstance.
Okay.
We call that a special enrollment.
And what are some of the
Special
special circumstances that a person can apply
A
after
change.
January 15th?
Like they lost coverage, maybe they lost their job and lost their insurance. They have 60 days to apply and get enrolled into the insurance from the date of whatever the change was.
Or if they have a new member, let's say mom has another child, that would qualify them to buy insurance that's for a special period, qualify them for a special event. So it's if you lose your job, you lose your insurance, you move from one state to another, or you are relocated with your job, that kind of sometimes gives you the ability to buy insurance. Or like I said, if they have if they adopted a child or they have a new baby in the household, a new member, that will give them, qualify them for a special event.
Now, what if a person is incarcerated after January the 15th and just in medical insurance? How can a person who has been incarcerated but didn't meet the 60 days, or how can they be able to qualify for Get Cover Illinois or any other medical program?
Well, if they're not employed yet, then they would qualify for the Medicaid.
Okay.
So that we would start off by enrolling and applying them for the Medicaid benefits.
Okay.
Once they get back into the society and get a job, they can still have the Medicaid for a little bit, until they go off their income. So once the income, if it's over the threshold, then we would report that change, and then that's when it would turn to, if their job doesn't offer it, then we could apply them for the Get Covered within that 60-day time period from when the income changed and they lost the Medicaid.
And what if they are unhoused? Are they still eligible for medical care?
No. If they are incarcerated, anybody that's incarcerated does get has a medical coverage through the state. The state pays for them to get medical coverage. Once they are released, depending on their circumstance, if, like Linda said, if they are not employed and they have no income, they may qualify for Medicaid. Once they are opt out of Medicaid because of their income, then that will give them a qualifying event to apply for health Get Cover Illinois.
And once they are released, and maybe they are unhoused when they are released, are they still eligible
Yes.
for medical
Yes,
assistance?
if they are in-house, so yes.
How does that work?
Well, there is on the application, there's a box that says homeless, and then they usually just put like a mailing address, so like a family member or friend's mailing address, or a shelter or wherever they're staying.
Or they sometimes we've had to put in the address of the Department of Human Services that
Okay.
it's going to be responsible for their case.
Okay. Now give me those phone numbers and those addresses again for our community who are in need of Medicare, Medicaid, and Get Covered Illinois.
Okay, so our line is 815-774-6090, and what was the other one? Oh, the address.
The address.
So the address is 1106 Neal Avenue,
Okay.
Neal Avenue, in Joliet, and also
Our other phone number is 815-727-8670. Again, at the 1106 Neal Avenue in Joliet, 60433. Either of those phone numbers, you can contact us. We are the navigators, are also known as the Medicaid ladies.
Thank you. I want to thank Miss Linda Larson and Miss Rosa Gomez for joining me today. And on our next session, Join us next time where we will welcome one of the extraordinary peer support specialists and community servants, Ms. Magdalena Campos from Heart Life Ministries. Goodbye, everyone.
Bye.
Bye.
Thank you. Thank you so much.
Thank you, Get Covered Illinois, for sharing your work, your impact, and your commitment to our community. And thank you to Lachey Hudson for your continued leadership of the Justice Alliance in guiding these powerful conversations. At New Day Employment Network, we are proud to host these Spotlight series and elevate organizations helping individuals rebuild, reconnect, and thrive. To learn more about our work, upcoming events, or to connect with the Justice Alliance partner, visit newdayemploymentnetwork.org. Be sure to join us next month as we highlight another Justice Alliance partner doing transformational work. Thank you for listening to the New Day Podcast.